Hey guys, we are back with another video. For those who don't know me, I'm Veralika. I study in the Royal Veterinary College and I just finished my final exams for my first year.
Hi guys, welcome back to another VetMed Ed video. So today Varlika and I are going to be talking about common misconceptions in the veterinary field, in veterinary medicine. Some common misconceptions in vet school and some that apply once you graduate and you're working.
So I want to start off with the pay a veterinarian gets. So people think that veterinarians get paid very lowly. It's true to a certain extent if you compare it with the human medicine field. So to give you a few statistics, veterinarians in the UK get paid 48k pounds per year compared to human medicine, which is 83k on average. So that's like half the amount. Most veterinarians don't go into the field because of the money. We go in it because of the passion. So I want to become a wildlife veterinarian, work with big cats, probably elephants, maybe work in a few national parks. So the pay in that is not too great because you're working for the economy, you're working to ensure welfare needs of wild animals, and humans aren't really affected by that, so they don't pay a lot. People do assume because of this, there's less opportunities for the vet field to get a job. This, I can tell you, is absolutely not true. So I can tell you for a fact that the job opportunities are endless for the veterinary field, and it's certainly growing.
The first misconception that I'm going to talk about is that a lot of people assume that a vet only plays with puppies and kittens all day and their job is not very demanding and they don't really do much apart from play with cute animals. That is not true. You're dealing with a lot of life and death situations, a lot of situations where you need to have good instinct and you need to be quick on your feet and save that animal or stabilize that animal. So you're dealing with a huge variety, and it also depends on which field you work in, whether you're working in small animal medicine, large animal medicine, with wildlife, with reptiles, with aquatic animals. So it really depends on what type of animals you are dealing with. So it's not always just playing with puppies and kittens. Yes, you do get to interact with a lot of cute animals, but the profession is very demanding and there's a lot more than just playing with, cute animals. So the next misconception is that there's only one field in veterinary medicine, and that's small animal medicine. So that is not true. There are a lot of other fields and you can specialize in what you're interested in. There is large animal medicine, there is wildlife, there are a lot of other different fields that you can go into. You can even be really specific and just specialize with one animal. You have a wide variety available and you can specialize in anything and work in any field that you would like. So it's not just small animal medicine. While that is the most popular one, it's definitely not the only one. The reason why it's more popular is because it's in a very clinical setting, and it's very I don't know how to put it, but like it's very like almost like human medicine, so very like Grey's Anatomy vibes. But that's why I feel like small animal medicine is more popular, because that's what you see the most. You see your dog or your cat or your guinea pig, hamster, whatever pet you have at home in the city, going to the veterinary clinic which practices small animal medicine. So that's what you see and that's usually what you know, and that's why that is the most popular one. It's also you have a better salary when you're working with small animal medicine. Actually, that depends. It depends on where you're working, which city you're working in, which practice you're working in, how big it is. It also depends on which organization you're working with. So it really depends. But yeah, usually you are paid better in small animal medicine. So that's why it's a more popular field, but that's not the only field. There's so many animals out there in the world, and there's so many animals that you can treat, and there's so many ways that you can specialize and go into a more niche field.
And in relation to the economy, people often have questions as to how veterinarians play a role. So I'd like to tell you a little bit about the One Health concept. One Health is basically a collaboration between human medicine and veterinary aspects. So if we talk about coronavirus in this pandemic, coronavirus is a zoonosis disease that in layman's term means that a disease transmitted from animals to humans. So coronavirus, people are assuming that it's come from bats, for example, and vet markets. So this means that the way to combat this disease is putting together the veterinary field and industry to help human health and our economy as a whole, right? So another way, for example, is veterinarians play a big role in the meat industry. So, for example, they come up with vaccination protocols for cattle. The beef market is huge. The veterinarians work with the farmers to optimize a correct health plan, including diet and vaccination protocols to prevent diseases such as zoonosis, which could be spread by consuming meat by humans. Another thing, people assume that veterinarians don't have that much of modern technology compared to humans. Well, I can safely say that our field is developed as much as the human medicine field. For example, if you take up laparoscopy, it's a non-invasive procedure for certain surgeries. It can be done to reduce the amount of time it takes for the patient to recover. So it's a developing field in human medicine and the veterinary field as well.
The next misconception is that if you hate humans, then you should be a vet because you're not going to be dealing with humans, you're going to be dealing with only animals. So that is not true. You are going to be dealing with a lot of humans, and in fact you're going to be dealing with a lot of emotional humans, and so you need to have excellent communication skills. You need to keep your composure, because a lot of the time animals that come in critical condition, you might have to euthanize them if that's what the owner wants, or treatment doesn't go as well as expected, and so the animal is really suffering, and you need to deliver some bad news. So a lot of the times they can get angry because they can blame you for not curing the animal, because they might not understand what exactly happened, or they can get really sad and emotional and break down at the clinic, or they might not have any emotion and they might be totally fine. You're going to deal with a lot of different kinds of people, and you need to learn to kind of adapt and cope well with different kinds of people. So the next misconception is a bit of a sensitive topic. It is veganism associated with veterinary medicine. So you would assume that if you're a vet, you want to help animals, and so naturally you would be vegan. Well, that's not the case actually. A lot of people who go into veterinary medicine, a lot of them just want to be a doctor, and so that's why they go into that field. So they're focused mainly on the idea of being a doctor. Some people are just seeing it as them helping animals who are sick, and so they are just focused on the medical aspect. There's some people who want to be vegan because it's a healthier lifestyle for their body, but majority of the people who become vegan, it's because of basically what's happening to our planet, and we can't be sustaining so many meat consumers or dairy consumers because we have a large population. There are way too many humans on this planet. Vegans don't want to fund organizations that produce dairy products or meat. A lot of vegans, especially against the whole artificially inseminating cows on farms, on dairy farms. so that they can produce more milk, which we consume. And I completely get that. I think being vegan is great. You're looking at the broader picture, you're thinking about our forests, our climate change, you're thinking about our planet, and you're being able to kind of think of the whole system as a whole, and not just focus on human needs. And veganism is seeing a lot of the broader picture, and a lot of vet students don't do that, and they don't focus on that. They just focus on the medical aspect of it. Yeah, I feel like I was just kind of all over the place with this specific topic, but the point is that when you go to vet school, not everyone's going to be vegan. There are actually a very small percentage of people that will be vegan. So it's assumed that veganism is associated with veterinary medicine, and usually you would end up being vegan if you're a vet student, but that's not always the case. Most of the time it's not the case.
So people often assume that in vet school we learn only about medicine and in a sense the treatments for animals, but this is far from true, because I've just completed only 1 year of my veterinary degree, but in the beginning and throughout the field, we've always been taught about animal ethics, animal welfare, and handling. And we've also gone on placements which help us apply what we learned in a practical field. So for example, we had the animal husbandry strand in our learning. So with there, we did learn about how to basically handle sheep reproducing. So we went and worked on a farm, which after we learned about management of sheep and their welfare, we helped the farmers. We volunteered our time. It's not only theoretical medical vet school what we go to. So we learn a lot about ethics, because in our practice, ethical scenarios are very common. So if a client comes up to you and asks you to put down a perfectly healthy dog just because she doesn't have enough money to take care of it, we learn ways to how to effectively communicate to give an effective solution by maybe telling the client different ways, like giving the dog up for adoption, for example. And we also learn a lot about animal behavior. So we learn about common psychological things, such as, what can I say? Well, if you give a dog a treat, you can train him to maybe do a couple of tricks. So it's the common things. These things are very common, but we do integrate this in our learning so that it's a well-rounded approach. That's a common misconception. Combat it. It's not only medical treatments what we learn in vet school. We learn a variety of things, and the things we learn, we apply this in our practical exams and our practical placements. Placements are the internships that we do while working with different species to integrate our knowledge. So this is in the Royal Veterinary College, but it's different for each college. But it's definitely similar for all universities.
So the next point is that it's a very unsafe profession, and you're exposed to a lot of diseases. While yes, you are exposed to a lot of different diseases and it can be an unsafe profession, it's not any different than being a human doctor, because even as a human doctor, you're interacting with humans that are sick, and you're interacting with diseases that you can contract because you're also human. So while yes, there are a lot of diseases in veterinary medicine that you can also contract, a lot of them is just from animal to animal, and it's not always animal to human. So they're not all of them are not basically zoonotic diseases. It's not that like, oh, veterinary medicine is more unsafe and you're dealing with sick animals and you're going to get some weird rash or infection. It's not like that. You're dealing with them in a very clean setting, and you learn how to deal with these situations in vet school, and it's very similar to human medicine. Just as much as you're exposed to different diseases as a human doctor, it's the same with veterinary medicine. Other misconception is that vets study for very few years and there's no opportunity to specialize. I touched upon this in a previous misconception, but yes, you can specialize in whatever you're interested in. You can decide which type of animals you want to work with. You can also decide what type of medicine you want to do related to those animals, what kind of surgeries you want to do. Don't assume that going in as a vet, that's you're going to come out and you're going to know everything. No, you're going to have to keep learning, and you're going to have to keep growing, and you can definitely specialize because medicine is such a huge field. I think I kind of like merged 2 points, but basically my other point was that after you graduate, there's this misconception that after you graduate you know everything and you have no more learning to do. That is not true. With human medicine as well as veterinary medicine, as time goes on, research is conducted and you learn more about different treatments, and you have to keep on learning, and medicine keeps evolving, and so you're gonna have to keep learning and keep brushing up on your medicine.
So our exams for RVC, I can touch a little upon it. So for the first term exams, we had 3 papers. We had our MCQs. This is our finals, and this is not including our our monthly internal tests. So this is for the final exams. We had a paper of MCQs. We had problem solving questions. We had a third paper which included an article which we have to interpret beforehand, and we're asked questions on it based on logical reasoning, and basically we dissect the article to kind of answer questions on it in the exam. And then our last exam, we have an oral exam. So we're assessed by 4 different professors on different topics, and that's to test our communication skills and further enhance the testing of our knowledge of what we learned and throughout the entire year. So in the first year in the RVC, we learned a lot about working with farm animals, like animal husbandry, elementary, and we covered almost all the topics as our first touch. And then in our second year, we revisit them to make a more profound impact in our learning. And then in our third year, we go on to our practical years, which is a more practical oriented field rather than just consuming theoretical knowledge. So year 1 and 2 is our foundation years.
So the next misconception is that you're not an actual doctor if you're a vet. This one a little bit upsets me because a vet is a doctor. You study for so many years in college. It's very competitive. You're learning a very, very similar medicine. You're just learning to apply it to different animals and not humans. You need to learn a lot about different animals, while as in human medicine, you're learning about just humans. While yes, you are going into a lot of detail with human medicine because there's obviously more studies done on human medicine, and so there's a lot more depth in it. You still have a lot to learn as a vet, and you're learning about many different animals. It's not just one single animal. Like for example, you need to learn the anatomy of a horse, a dog, a cat, a hamster. Like you need to know all of this, and you need to know what medicines work on a horse but might not work on a dog. So you need to know all these things. Everything doesn't work on every animal. And there was this one thing which I heard where people were arguing that some humans, they also have like other conditions, and so some medicines might not suit certain people. Like, for example, a human might have diabetes or some allergy to certain medicines, so you're going to have to learn alternative medicines. And they were comparing that to knowing alternative medications for different species of animals, and I just didn't see how that connected, because a dog can also be allergic to certain medicines. A dog can also be undergoing other kinds of treatments, and so certain medications might counteract those medications. So I didn't really understand that argument, while at the same time you need to know what medicines work on like a horse and might not work on a cat. So there's a lot more like variety when it comes to veterinary medicine, so there's a lot more stuff that you need to like memorize. You can't be injecting something for a horse in a hamster, like it's just not gonna work. And sometimes horses can be allergic to certain medicines, sometimes hamsters can be allergic to certain medicines, so you can't compare a human and all the animals of the world. You can't compare that, so that was a bit weird. So yeah, vets are actual doctors. I don't know who came up with this idea that they're not. You do have a doctor before your name, and you do practice actual proper medicine, and you do have a license to practice after you graduate. So with that being said, those were all of my misconceptions. Yeah, let us know if you enjoy these kind of videos, and what other kind of videos you would like Varlika and I to, you know, make together. Yeah, so those were the misconceptions. I hope I wasn't all over the place. Thank you for watching. Bye.
If anyone has any doubts, you can always put that in the comment section, and we'll try our best to figure out a way while doing our research and with our knowledge we have to help answer your questions. So thank you for listening today. I hope you had a glimpse of maybe a little more clarity of what doubts you had in your mind. Thank you so much. Bye.